After college graduation, many of my classmates got married. I wasn't ready for that. I wanted to travel, have unique experiences and adventures. Well, a fast-talking military recruiter got his hooks into me, and before I knew it, I was commissioned a second lieutenant in the United States Air Force Nurse Corps. I believed that I was following the Kennedy mandate of ask not what your country can do for you, but what you can do for your country. Military nurses were badly needed in 1968. And at that stage in my life, I still believed that the United States was doing the right thing in Vietnam. In 1969, I was sent to Vietnam. I had just turned 24 and was assigned to a surgical ward where we cared for injured patients both before and after surgery. Some very serious, very nasty injuries. I learned ugly new diagnoses: MFW, multiple frag wounds; GSW, TNT, gunshot wound through and through; BK, AMP, below the knee amputation. Most often, patients had multiple diagnoses because multiple injuries were common. Post-operative patients had IVs, often blood hanging. There were chest tubes to suction blood out of injured lungs, pumps to suction bile and gastric fluids out of patients with abdominal injuries. I can remember looking down that long line of beds and seeing a sea of IVs and blood bags hanging and all sorts of medical machinery humming, and thinking, how in the hell am I going to handle all this? The sounds of the ward, groans, weeping, the noise of the suction machines, the hiss and gurgling of the oxygen tanks were all disquieting. The smells were worse: vomit and feces, blood, infection, burned flesh, bile, sweat, and fear, all mixed together. Everything smelled to high heaven in that place. At night, you could smell the crematorium, where they incinerated amputated limbs and body parts. Every time I get even a small whiff that is reminiscent of that stench, I am back there, seeing things people shouldn't see, hearing things people shouldn't hear, and smelling things people shouldn't smell. Halfway through 1970, I became the hospital night supervisor. Brilliant military thinking. Put a 24-year-old nurse, 2 years out of college, in charge of a hospital in a combat zone on the shift when we received the most casualties and we most often came under attack. Are you fucking kidding me? One night, the nurse on the Vietnamese ward phoned that she had an infant in acute respiratory distress. I went down to the ward to help and was surprised to see that the doctor on call was already on the scene. Very unusual for a doctor to show up that quickly at night for a Vietnamese patient. I learned that the doctor was new in country, but of course. We spent hours trying to save that tiny baby, while I was thinking, let it go, it'll be better off. The baby died, and I was amazed at how upset the doctor was. What's one less baby in this war anyway, I thought. I had been in country too long. Most physicians there were very caring and competent, but there were some notable exceptions. Two of the surgeons on my ward would have felt at home in Nazi concentration camps. One doctor got his kicks by inflicting physical pain on the patients. He would make the rounds, ripping off patients' surgical dressings. These were usually stuck to the wounds, and tearing the dressings off made the wounds bleed again, and the patients would scream in pain. That bastard. To outwit this sadist, ambulatory patients stationed as lookouts would alert us when the surgeon was headed our way. While the corpsmen ran around soaking everyone's dressings with saline so that they could be removed more easily, I got busy giving morphine injections to ease whatever pain that surgeon was going to inflict. I wanted to kill that doctor. Another surgeon started ordering dangerously high doses of a new antibiotic that had extremely serious side effects: liver failure, kidney failure, and deafness. What was so weird about this was that he only ordered these doses on non-American patients. When I questioned the surgeon about these orders, he basically told me to just do it. This just wasn't right. I was in a real ethical and moral bind. In good conscience, I could not obey the doctor's orders to give hazardous levels of an antibiotic to any patient. But here I was, stuck in Vietnam with no way out. It wasn't like I could quit my job. Somehow, someone on the ward discovered that the surgeon was conducting a study to determine toxic dose levels for the pharmaceutical company that manufactured the antibiotic. We younger nurses all got together and decided that none of us would give deadly levels of this antibiotic to any patient, but that we would document on the patient's record that we had given the drug as the doctor ordered. Screwed up that drug study, you betcha. One thing I will always regret is that after coming home, I did not report this surgeon's conduct to the authorities. And I should have. Does anyone get that this was a war crime? Vietnam left me with a feeling that what I did was not enough. I had too many patients to take care of. I had too few corpsmen to help me care for these wounded soldiers. I had to practice shoddy nursing. All I had ever wanted to do was to help people. And here I was in a situation in which I was most likely making a lot of mistakes. I never had enough time, staff, or supplies to do a good job. It left me with a lifelong feeling of not being good enough, not doing enough, not knowing enough. It also hardened this nice Irish Catholic girl in the extreme, turning me into a stony-faced, cold young woman who could walk right past patients who were crying, "Nurse, nurse." Because I knew that whatever they wanted wasn't life-threatening, and that I had more urgent nursing business to attend to. None of us knew back then that we were living in a haze of toxic chemicals. It was many years later that we learned about the widespread spraying of Agent Orange in South Vietnam. The Environmental Protection Agency has called one of the components of Agent Orange the most toxic molecule known to man. I feel that my own exposure to Agent Orange resulted in the development of my breast and ovarian cancers. 2 other nurses with whom I served also developed breast cancers, and each of them then went on to develop additional serious cancers. I also believe that Agent Orange caused serious problems for my daughter. As Agent Orange crosses the placental barrier, a woman who has been exposed to it can pass it on to her unborn child. My daughter had very poor immune system functioning for much of her childhood and suffered with severe headaches and joint pain. Doctors couldn't figure out what was wrong. I believe these problems were due to her exposure to Agent Orange in utero. In 2003, my daughter gave birth to a son who had a life-threatening intestinal deformity that the Veterans Administration has identified as being caused by exposure to Agent Orange. The people in Vietnam have, of course, suffered more than anyone from their exposure to this poison. In July of 2004, I was diagnosed with advanced ovarian cancer. The surgeon told my family that she wasn't sure that I would survive the surgery. I was in very bad shape. During my hospitalization, I was at death's door on more than one occasion. When I finally got to come home, I knew that I was facing 8 months of brutal chemotherapy. And I knew there were no guarantees that I would go into remission. Pretty overwhelming, pretty frightening. But I was given the most precious gift. Through my suffering and nearly dying, I experienced a profound change within my spirit. I discovered that many people cared about me and wanted to help me. I had never been any good at letting other people help me in the past, but in this case, I simply had no choice. I had to let people take care of me. I had to let people into my life. My hardened spirit began to heal. The love of both friends and strangers was a curing force. The tremendous gratitude that filled my heart left very little room for the anger that I have carried since I served in Vietnam. To have that anger lifted from me was the most precious gift. It gives me great comfort to know that I will not die in that anger. I actually began to feel lighter and brighter, even though I was still very sick and had a very unfavorable prognosis. Given a choice, I would rather have the healing of my spirit that occurred than any physical healing. That's how important this gift was. It changed my life forever. Having that anger gone is truly a miracle and source of great joy. And I am indeed a fortunate woman.